Hello students, let's study Mycobacteria. So in that we will see Mycobacterium tuberculosis, Mycobacterium leprae and non-tuberculous Mycobacteria. Hello students, let's study Mycobacterium tuberculosis, which causes tuberculosis. So Mycobacterium tuberculosis morphology, beaded rod, occurs singly, pair or clumps, mode of transmission, inhalation, pathogenicity, tuberculosis. Clinical manifestation, pulmonary tuberculosis and extrapulmonary tuberculosis. So in pulmonary tuberculosis, patient may have symptoms like fever, loss of weight, anorexia, and sputum production. Extrapulmonary tuberculosis, tuberculous lymphadenitis, posterior cervical or supraclavicular lymph nodes common, painless swelling in neck region, pleural tuberculosis, pleural effusion, tuberculosis of upper airways, larynx, pharynx, epiglottis, renal tuberculosis, gastrointestinal tuberculosis, genital in females, fallopian tube and endometrium causes infertility, males, epididymis tuberculosis, tuberculosis of CNS children common, tuberculous meningitis, miliary or disseminated tuberculosis. And in bone also you can see that is tuberculous bones. Lab diagnosis of tuberculosis. So there are two types, active tuberculosis and latent tuberculosis. So first we will see active tuberculosis. So specimen collection is pulmonary tuberculosis sputum and in extrapulmonary tuberculosis according to the infection like tuberculous meningitis, CSA, renal tuberculosis, urine, etc. Spot sample and early morning sample at least 2 to 5 ml and preferably mucopurulent. Digestion, decontamination, and concentration by modified Petroff's technique that is 4% NaOH, NaLC, N-acetyl L-cysteine plus 2% NaOH. Then direct microscopy by Zell-Nelson staining. So long, slender, beaded, red color bacilli, that is acid-fast bacillicin. Grading according to the RNTCP, Revised National Tuberculosis Control or Eradication Program. So 0, no AFB per 100 oil immersion fed. Scanty 1 to 9 per 100 oil immersion fed. 1 plus is 10 to 99 per 100 oil immersion fed. 2 plus is 1 to 10 per oil immersion fed and 3 plus is more than 10 per oil immersion fed. Second microscopy is fluorescent staining or amine rhodamine dyes are used, so more sensitive, bacilli brilliant yellow against the dark background. Culture, conventional and automated. So conventional solid Lowenstein Jensen medium for Mycobacterium tuberculosis. So after 6 to 8 weeks, typical rough tub buff color corn is seen. Disadvantage, it takes 6 to 8 weeks. Liquid media Middlebrook 7H9. Culture identification is done by MPT64 antigen by immunochromatography or by Malditoff technique. Automated midget mycobacterial growth indicator tube. It takes 3 to 4 weeks. Middlebrook 7H9 medium is used. Promote growth of M. tuberculosis and drug susceptibility testing. Principle, oxygen sensitive fluorescent compound in the broth quenches emissions from the fluorescent compound. Quenching effect is lost if organism grow and uses oxygen. Molecular PCR Sibinat gene expert. You can get reports within 2 hours. TrueNet. Latent tuberculosis tuberculin test or gamma interferon. So principle of tuberculin test, type or hypersensitivity reaction. Procedure, 0.1 ml PPD injected intradermally on flexor surface of the forearm. Observation 48 to 72 hours. Positive induration more than 10 millimeter or more. Doubtful induration between 5 to 9 millimeter. Negative induration less than 5 millimeters. Prophylaxis against tuberculosis. BCG vaccine, that is Bacille Comet Corin vaccine is used. The strain is live attenuated M. bovis Danish 1331 strain. Lyophilized form seen used. Administration is 0.1 ml containing 0.1 milligram of PU. Site above the insertion of left deltoid, root intradermal. Protection, duration of immunity 15 to 20 years. Definite protection to infants and young children against tuberculous meningitis and disseminated tuberculosis. Complications following BCG. Most common ulceration, regional lymphadenitis, rare keloid or lupus lesion, osteomyelitis, non-fatal meningitis, progressive tuberculosis, Then contraindications to BCG include HIV positive child, child born to AFB positive mother, child with low immunity, generalized eczema, pregnancy. Other uses of BCG induces non-specific stimulation of the immune system, leprosy and leukemia, adjunctive therapy in malignancies, bladder carcinoma. Hello students, let's study non-tuberculous mycobacteria. Non-tuberculous mycobacteria, also called atypical mycobacteria. So, mycobacteria other than human or bovine tubercle bacilli that may occasionally cause human disease similar to tuberculosis are called atypical mycobacteria. Importance: infections with atypical mycobacteria is resistant to antituberculous drugs. Classification by rayon, depending on the pigment production. Photochromogen, pigment in light, example M. canasi, which causes chronic pulmonary disease. Photochromogen, pigment in dark, example M. scrofulaceum, which causes cervical lymphadenopathy. Non-photochromogen, no pigment production, example M. intracellular, which causes CPD. Rapid grower, rapid growth, N. segmatis. The lab diagnosis: specimen, sputum, lymph node aspirate, pus exudate, biopsy, skin, microscopy, Zn staining, acid fast bacilli, Zn staining 5%. Then culture, the pigment production. LJ media are incubated in dark and light separately for photochromogen and scotochromogen. Species of NTM can be differentiated from M. tuberculosis complex by MPT64 antigen by immunochromatography, and which is negative for atypical mycobacteria. Newer methods, MALDI-TOF, matrix assisted laser desorption, ionization time of flight, PCR. Newer methods, MALDI. Hello students, let's study Mycobacterium leprae. Mycobacterium leprae, Leprabacillus, first discovered by Henson. Morphology not cultivable, can be maintained 9 branded armadillo or footpad of the mouse. Intracellular and strict aerobe. Appear in groups cigar-like bundles in Virchow's lepra cells. Grow in cooler areas of the body like skin, peripheral nerves, upper respiratory tract, eyes. Generation time is 12 to 13 days. Pathogenicity: leprosy. It is chronic disease involving skin, peripheral nerves, nasal mucosa. Clinical manifestation: first, skin, markedly demarcated anesthetic patches. Nerve involvement, deformities in hand and foot. Nasal mucosa, broad nose, loss of eyebrows, complications due to nerve injury, disease process, injury, face, linonin faces, sagging face, loss of eyebrow eyelashes, saddle nose and corneal opacity and ulcers. Hand, claw, hand and wrist drop. Foot drop, clawing of toes, inversion of foot and plantar ulcers. Types according to Ridley-Joplin classification: tuberculoid TT, borderline tuberculoid BT, borderline BB, borderline lepromatous BL, lepromatous LL. Lepromatous and tuberculoid leprosy differences. So, skin lesion in lepromatous many, symmetrical, margin is irregular, multiple nodules are called as lepromata. Plaques, xanthoma-like papules, leonine faces. In tuberculoid, one or few asymmetrical, margin is sharp, lesions hypopigmented, annular macules with elevated borders, tendency towards central clearing. The bacillary load in lepromatous multivacillary, tuberculoid paucivacillary. Bacteriological index: lepromatous 4 to 6, tuberculoid leprosy 0 to 1 plus. Nerve lesion in lepromatous appear late, hyposthesia is a late sign. Tuberculoid early aesthetic, skin lesion, enlarged thickened nerves. CMI in lepromatous low, tuberculoid normal. Lepromin test: lepromatous negative, tuberculoid positive. Laboratory diagnosis of leprosy: first specimen collection, 6 samples, 4 skin from forehead, cheek, chin and buttock, 1 from earlobe and nasal mucosa by nasal spray or the blow or the scraping. Slit skin smear to collect skin and earlobe specimens, tissue pulp from below the epidermis, nasal specimen, nasal blow, early morning mucous material, nasal scraping, mucosa scraper, to scrape the nasal septum, biopsy thickened nerves and nodular lesions. The microscopic examination, Zn stain, 5% sulfuric acid used as a decolorizer, acid-fast bacilli, red color rods, singly or in groups, cigar-like bundles, globi, in virtuous lepra cells or foamy cells. Live bacilli, uniformly stained with parallel sides, dead bacilli, less uniformly stained, fragmented and granular. Grading 1 plus 1 to 10 bacilli in 100 oil immersion field, 2 plus 1 to 10 in 10 oil immersion field, 3 plus 1 to 10 in per oil immersion field, 4 plus 10 to 100 per oil immersion field, 5 plus 100 to 1000 bacilli per oil immersion field, 6 plus more than 1000 bacilli or bacilli in clumps in each oil immersion field. Bacteriological index, total number of bacilli, live plus dead, per oil immersion field. Morphological index, percentage of uniformly stained bacilli out of total number of bacilli. MI is better marker to monitor the treatment response. Culture, it has not so far been possible to cultivate leprabacilli in bacteriological media or tissue culture. Leprabacilli could multiply in foot pad of mice at 20 degrees Celsius or 9 banded armadillo. Diplomin test, skin test for delayed hypersensitivity reaction. Observation, early Fernandez reaction, more than 12 to 48 hours in duration. Late or Mitsuda reaction after 21 days. Positive test, nodule more than 5 millimeter and then ulceration. Uses of leprominase to classify leprosy, positive, tuberculoid, negative lepromatous, to assess prognosis and response to treatment, positive, good prognosis, negative, bad prognosis.
Hope you find this session useful for your understanding and for your exams. Thank you.